Newcastle. Let us talk to Professor Neil Ferguson, Director of the MRC Centre for Global Infectious Disease Analysis at Imperial College London, whose work, of course, has informed government thinking right from the start of all of this. Good morning to you.
Good morning.
Just to start with what we were hearing there from Newcastle, does that make a difference if we do have those kinds of curfews, given the upset that they cause and the feelings of annoyance and anger that they cause? Does it still work?
It will have some effect on contact rates. I mean, the overall problem we have at the moment, and it was anticipated all the way back in March, that as we relaxed lockdown, contact rates in the population would go up. And that would inevitably lead to resurgence of the virus in the population. It's actually taken a bit longer than we anticipated, and that's because it took people longer to get closer back to normal than we anticipated. You can't always predict human behaviour, but we have, in some sense, a perfect storm right now of people, as they've been told to, getting back to normal, schools reopening, a surge in cases, and therefore the testing system is under strain. So, unfortunately, we do have to roll relaxation of measures back a little bit and get contacts down in the population.
Right, and when you say roll them back a little bit, be specific.
So a number of measures are being considered and they've been talked about in the press. I think there's fundamentally what we need to do is get to a steady state, a level of interactions in society and the new normal in society which doesn't cause the virus to surge up. That may not be possible, which is why you've heard talk of a kind of 2-week mini lockdown. It wouldn't be a full lockdown, but it would involve many more restrictions in order to, in some sense, reset the virus.
But when you say many more restrictions, what? Preventing families from meeting other families, preventing people from going abroad perhaps as well? Are those the sorts of things we've got to look at?
Potentially, certainly the former of those. Reducing contact rates between people is the fundamental thing, and it makes some sense to consider it to be timed at the same time as, for instance, half term, because then also you don't have children mingling in schools. What we'd like to move away from is the epidemic doubling every 1 to 2 weeks.
But of course, at half term, quite a lot of people do travel, and quite large numbers travel abroad too.
Yes, and that poses some risk, but the bigger risk, because most people don't, the bigger risk is within the country as a whole. It's just everyday interactions, perfectly normal interactions between people, and we've just got to dial those back a little. And you heard just in the piece you played, I think a lot of people are trying to do that. I mean, they are behaving responsibly and behaving largely within the rules. It's just the level of contacts is just that bit too high.
When should we do this, in your view? Because half-term is still some way away. Would it make more sense, at least in terms of epidemiology, to do it faster?
So the benefit of introducing some measures, whether it's a 2-week a mini lockdown, whatever you want to call it, or just some more restrictions, is that you reduce spread when infection is still at relatively low levels. Right now we're at about the levels of infection we were seeing in this country in late February. If we leave it another 2 to 4 weeks, we'll be back at levels we were seeing more like mid-March. And that's going to clearly cause deaths because people will be hospitalised, but it will stress the health system and cause a testing system which is already, as we know, under massive strain.
So in your view then, Professor Ferguson, you think the sooner the better, and presumably that view would be shared by people on SAGE.
I think some additional measures are likely to be needed sooner rather than later. The timing of any more intensive policy, temporary policy, I think is open to question. I think there are many things to balance in that. And I, for one, do think children's education is important, so suddenly disrupting that would be problematic. It's not an either or. I mean, what is going on at the moment is scientists, policymakers are trying to balance the benefits of, epidemiologically, of reducing transmission with additional measures against the harms those measures cause. And it's not an easy equation to balance.
And what some say is, why can't we be like Sweden? Why do we have to do all of this stuff?
So Sweden, I have conversations with colleagues in Sweden. Sweden is not back to normal. Behaviour is very different from what it was a year ago, though. There is social distancing. There are local restrictions put in place when they find clusters of cases. It isn't as different from this country as you might imagine.
But there are two things about Sweden, though, aren't there? And this is what the Swedes themselves say, and they said it regularly in interviews, in a way right from the beginning, that number one, they've placed the responsibility much more on individuals. And number two, they use this word sustainable. They say they've had a strategy that you can explain that is sustainable. It's there for the long term. And that actually has paid off. And it is, isn't it? When you look at the death rate in Sweden and you compare it to the rest of Europe, they do not seem to be suffering in the way that the rest of Europe does.
I mean, Sweden took longer to pull down deaths than, for instance, their neighbouring countries. Neighbouring countries are now seeing a resurgence of cases. Sweden is still at low numbers. We will have to see what happens in the coming weeks. I certainly agree all countries need a long-term sustainable strategy, at least to get us through the next few months.
But the point about the Swedish strategy, though, is that it does not veer, as some see us veering, between extremes, letting people go and then locking them back down again, and that actually should be the way that we should be looking.
I completely agree, and I said that earlier in this interview, that the lockdown, a mini lockdown is only a strategy to try and pull case numbers down to make the infection rates more manageable, given the testing system is under strain. What we do absolutely want is to find that happy medium of not normal interactions, but as much interaction that contacts normal activity in society as we can manage whilst maintaining constant infection levels. What that will be will vary from country to country. Sweden is a very different country from the UK, and you can't necessarily just completely adopt what's going on there in this country.
We talked to the Health Secretary yesterday, and he said the purpose of locking down now, and indeed the government's strategy, is suppression, and then, as he put it, waiting for the cavalry being a vaccine. Can that work?
We looked at this back in March. In theory, you have to go through cycles of it. You can lock down, then completely relax, and then lock down again. My own view is, at the moment, a temporary lockdown, and it wouldn't be like it was in March. It would be less restrictive than that, but it would pull down infection numbers to allow the testing system to cope a bit better. But I think actually what we want is to have a set of sustainable measures through until we have vaccine, not go through this cycle again.
Can I ask you a question? You were involved in SAGE right at the beginning of all of this, and the discussions that were held then and the planning that was done then and into the summer then about schools and the impact that schools could have. Because we heard very certain terms from Dido Harding, who's in charge of track and trace, that actually SAGE had not planned for the kind of extra demand on testing that came when the schools were reintroduced. Is that your understanding?
So the key issue around schools is how much transmission happens there. And we still don't know the answer to that. We're getting an indication. I should say SAGE was never responsible for predicting demand for testing. What we have been involved in predicting, the scientists feeding into SAGE, has been the likely infection levels in the population. And then the test and trace system is intended to kind of plan for the demand. What I would say is it was completely unanticipated, I think, by anyone, that what happened when the schools reopened was not necessarily a surge in COVID infections, but parents and teachers getting concerned about people, students with coughing or spluttering, most of which was not COVID. So we saw a huge surge in testing of children, most of whom, 97% of whom, tested negative. But that surge in demand was not anticipated.
No. All right. Well, Professor Neil Ferguson, thank you. And we will be coming back to the business of what happens next, of course, during the course of next week on the programme with a range of views. Thank you for talking to us.